Hi guys, today's lecture about Thornwaldt cyst. Thornwaldt cyst is a benign developmental nasopharyngeal midline cyst covered by mucosa anteriorly and posteriorly covered by longus colli muscle. So between mucosa and longus colli muscle, it is Thornwaldt cyst. It was first noted by Mayer in 1840 in autopsy specimens. It was established as a pathological entity by Thornwaldt in 1885. It is also known as pharyngeal bursa, nasopharyngeal bursa, and Thornwaldt cyst. Hoover later described its development because of irregular notochord regression in 6 weeks of gestation lead to Thornwaldt cyst formation. The Thornwaldt cyst has been seen all age group, peak incidence between 15 to 30 year of age, and it's common equal in male and females. If you see clinically, Thornwaldt cyst almost always asymptomatic, about 90% of cases. However, they become infected, may have halitosis, periodic discharge, or mm, post-nasal discharge, and sometimes nasal may be used to into obstruction may lead to otitis media. It is having two types of cyst, crusting and cystic. Crusting having an opening in the midline which continuously discharging, and cyst is epithelial respiratory epithelium which having proteinous content inside it. This cyst may be formed because of inflammation or obstruction or maybe developmental error. So closure at the orifice results cystic type, while crust is orifice which is continuously discharging. So it is two type, crust type and cystic type. If you see, this is cystic type of nasopharyngeal bursa which having respiratory ciliated epithelium over it, and this having inside proteinous content which is variable. It may be thin, thick or mucus according to the proteinous content inside it. If it is enlarged, it may obstruct this eustachian tube nearby, may lead to otitis media. Diagnosis, typically it's well circumscribed rounded lesion immediately deep to mucosa and usually anterior to longus colli muscle in the nasopharynx. Size may be variable between 2 to 10 mm normally. It may enlarge up to 3 centimeters sometimes, which may lead to nasopharyngeal obstruction also. So this cyst is mostly asymptomatic and incidental finding during your X-ray or CT scan or MRI for other head and neck pathologies. So this is not commonly pathological. This epithelium of this cyst is just like nasal epithelium because nose to nasopharynx is covered by ciliated pseudostratified columnar epithelium. So it is pseudostratified columnar epithelium over the this lesion. If you do CT scan of this lesion, it is having protein content and hypointense, and there is hypointense area in this. You can see there is no enhancement in this cyst, or sometimes it may be solid also. But in MRI, if you see this cyst having, in T1 it is variable depending upon the protein content, but T2 is mostly high intensity lesion because it's seen in water content or proteinous content show it hyper intensity, but in contrast it's not showing any enhancement because there is no vascularity in it and liquid inside it. So this is MRI of nasopharyngeal. DD may be neuroenteric cyst, meningocele, remnant of adenoids, adenoid hyperplasia. These are the mainly DD of this lesion. Treatment mainly, if it is asymptomatic, no treatment required. If it is symptomatic, mainly we do marsupialization if possible. Complete excision should be done if possible. and most of the cases, if it is large enough, then marsupialization is sufficient. So this is all about nasopharyngeal bursa or Thornwaldt cyst. Thank you so much.